There's a significant debate going on in Canada amongst public health officials over the primary means of transmitting COVID-19. And this is a significant debate. Doesn't take place in public, but nevertheless, it has a big influence on policy. And the debate is between those who think the primary means of transmission are droplet and touch, which has been the norm for the last 18 months, versus aerosols, which are little tiny droplets that hang in the air, kind of like cigarette smoke. And if you accept the science around aerosols, it means that you have very different types of intervention to prevent COVID-19, things like ventilation and air purification in schools. Well, the government in Victoria, Australia, has just purchased 51,000 air purifiers. Every classroom and every public school in the province is going to get an air purifier. And I'm going to talk to Professor Jason Monty, and he's head of the Mechanical Engineering Department at the University of Melbourne, and he joins us from Melbourne, Australia. So welcome to the interview, Jason.
Hi, thanks for having me.
So the 51,000 air purifiers, $190 million, this is a big project. Were you involved in the project and consulting in any way?
Yeah, I've been advising government for about the last 12 months now on various interventions for aerosol transmitted COVID-19. So that involves a number of things, including hotel quarantine and also government buildings and now schools as well.
So I would assume then that the discussions that you had with the government officials revolved around protecting children, K to grade 12 from COVID-19 transmission. Why air purifiers? What led them to make that decision?
Well, the science behind air purifiers themselves is very well done. We know that air purifiers work really well to take particles out of the air. So the particles I'm talking about are the kind of, as you described, the cigarette smoke type size particles, very small things that can hang around for hours if there's no airflow. And we know those work because they're called HEPA filters, high efficiency particulate air filters. And they work very well because they're used in clean rooms all around the world, to even in an industrial scale, to clean up the air. So they take away very small things. So we know those work for that. Now the question then becomes, how do they work for infectious disease? Well, we know that infectious disease the virus is very small, like 100 nanometers, but it doesn't live by itself. It has to be on an aerosol or another particle. And when the humans expel mucus that comes out as a sneeze or a cough, and the droplet sizes that come out can be very small. They are typically 1 to 2 microns on average, and that kind of size will float around in a room for a very long time, and the virus lives on those particles. So if that is happening, if those particles are hanging around for a long period of time, you turn on an air purifier and it catches those particles. We know that will happen.
Now, in a school classroom, which are largish rooms, will one air purifier completely eliminate the virus from the air? Can it turn over the air that quickly? Or does it simply reduce the viral load to manageable levels for the children?
Yes, so this is the problem. Air purifier is not a cure, right? It doesn't take away all disease instantly. It works by pulling air through a filter, and that process takes time, obviously. The stronger your fan, the more you're going to pull through, but it's still a process. Air's got to go from one side of potentially infected air has to go from one side of the room to the other and go through this filter. So you can only talk about risk reduction. And from our studies, what we've shown is that appropriately sized air purifiers in a classroom can reduce the risk by around 10 times. Combining that with a mask, and you're reducing your risk by hundreds, if not 1,000 times. Now, why air purifiers are so important then, if they're not as great at reducing risk as a mask is. So why are they so important? Well, because people have to remove their masks, or kids might knock them off, or other unforeseen things can happen with masks, and these give you that added protection. So it is a risk reduction. We can't talk about removal of all risk.
So public health officials talk about the Swiss cheese model, where you've got layer upon layer upon layer of protection or intervention, and none of them are perfect, but add them all together, and you've got very good protection. And it sounds like that's this approach. If you've got masks and you've got air purifiers and you've got social distancing, maybe eventually you get vaccination, all of that adds up to a significant protection for children. Have I got that right?
That's right. There is actual science on this. It's hot off the press. In fact, there's one study from Cambridge coming out now. And I know it's under review. It is published on medRxiv, and where they have an air purifier in an ICU. And without the air purifier, they use a biosampler. So if I just step back a sec, sorry, that it's really difficult to measure COVID-19 in real time. So this is why we don't want to be unfair to scientists or clinicians. It is a difficult question to answer. Is there aerosol transmission or droplet transmission or surface transmission? It's not easy. And in fact, there's still debate over whether how much influenza is aerosol transmitted versus surface contact or direct droplet contact. So, it's not an easy thing to measure. And one thing that you need to catch the virus is something called a bio-air sampler. This is something that doesn't destroy the virus when it captures it and then allows you to measure it. So they did this in the ICU in Cambridge, and it's actually been done here in Australia as well. And they measured lots of COVID-19, as you can imagine, in the ICU because there's COVID patients there. They turn the air purifier on, the levels all go to zero very quickly. So there is evidence that it actually does remove virus from the air, not just the evidence that there's plenty of that it reduces particles.
You mentioned earlier in the interview that you've been consulting with the government, and I gather that over the last year to 18 months, there's been a very, shall we call it, vigorous debate around the whole droplet and touch versus aerosols. And the government and public health officials have finally accepted the science around aerosol transmission. Can you tell us about that, please?
It has been a long process. I would say it's not completely over yet either. Getting acceptance is one thing, then getting action is where you truly find out whether politicians and officials actually believe the science. And it's difficult to convince somebody when you can't put actual numbers to every space. So we can't say, nobody can say how much aerosol transmission is in a school, because there's questions over how much viral load children have, whether they're transmitted to each other, whether it's the teachers interacting, getting it from home. There's so many different questions. And you when it comes down to it, if you've got somebody who's in government making decisions, but wants the answer, does this stop infection or not? If it comes down to that, then it can be very hard to convince somebody because you can't get that evidence. What's happened over the past 12 months here is that essentially what happened is we managed to find a way in to government, which turned out to be through hotel quarantine, which was going through major problems about September, October last year. And that they decided that ventilation could be the only way that they were getting transmission. They were seeing transmission between rooms where there was no personal contact at all. They were seeing security guards at one end of a hallway getting infected when they'd never been anywhere near people in the hotel that were confined to their rooms. And so people started to realize, so we were fortunate in Australia that there was no community transmission. So security guards couldn't have got it from home. They couldn't have got it from anywhere else. The only place that they were anywhere near in contact was in the hotel. And the only way they could have got contacted is if the air was carrying the virus to them. Then we went into those situations and we measured the airflow and found that the air was indeed going from the rooms to that security guard. And that was all the convincing I think they really needed for the hotel quarantine. And then once we were talking with those people, then you've got it into the government and then more people started to pay attention. So it wasn't easy, but we got there.
Did you see the initial reluctance within the public health officials with the government, who had, their accomplished doctors and medical professionals had been trained on droplet theory, droplet transmission of diseases? Was there a real reluctance to accept the new science?
Yeah, absolutely. We literally have letters from our government, our health minister, saying thank you for your concern. But we've looked at the science and we don't think aerosol transmission is important at this stage. It was hugely disappointing because we knew what we could do. I'm not a clinician and I'm not a virologist. I'm a fluid dynamics professor. So I know about airflow and I know how the air purifiers work. So I know that you can do something about it. What actually surprised me, and it still surprises me, was that people associate airborne transmission with, or are more fearful of airborne transmission than droplet transmission. And as a fluid dynamicist, that actually surprises me because I'm just as scared about touching something as I am of getting it through the air. Or put it the other way, I'm as confident that you can do things with the air as you can with touching surfaces. Just because you can physically clean a surface and you see the results of that, that doesn't save you from picking up a can of beans that somebody else has picked up with and just sneezed on their hand in the supermarket. So to me, cleaning the air, which I can have a device that does constantly, as opposed to having to rely on somebody to come and clean those cans of baked beans or whatever it is that I'm about to touch, I don't see any different. I don't see why you should be more fearful of one over the other. But there's clearly fear about airborne transmission.
Sure. What about the school districts and the school principals, Jason? Once the government had made the decision, okay, we're going to accept the aerosol transmission science, were the school districts and school principals on board with the air purifier project?
Well, I mean, I can't speak for all of them, but I think that the schools, just like the hospitals, so we've been working a lot with hospitals, getting air purifiers into hospitals, and that's been very successful. I think the schools, just like the hospitals, are really grateful that people are coming to help. I think in both scenarios, they're high risk work situations, and I think that those workers feel like they've been left behind in this discussion. I feel like they feel like they've been left behind, and with this decision, I'm pretty sure they feel like somebody is actually looking out for them.
Now, I'm interested in the healthcare workers, and particularly in hospitals, because there's been a fair amount of debate in Canada about healthcare workers, medical professionals picking up and being infected within a hospital environment. What was the situation with the hospitals, and why were they so grateful to get the air purifiers?
So nurses in particular in hospitals and infectious diseases were very concerned that the government wasn't doing enough to help. And I'm sure this was the same all over the world. They weren't getting enough masks. They weren't getting good advice on who should be wearing which masks. Gowns were running short. Everything was running out. And there was a general feeling like there wasn't enough being done. Once they started to sort out the supply issue for the PPE, then they started to ask other questions. And similar to the hotel quarantine, actually, we didn't have community transmission, but healthcare workers were getting infected. So there's no question where they were getting it. And in particular, the hospital that we were working with, it's very close to the University of Melbourne, was very confident that their workers were using PPE correctly. So they were wearing N95 masks correctly, they were donning and doffing correctly, they were doing everything that was asked of them, and they were still getting COVID-19. And then they said, well, let's check out the ventilation system. And they got us in to map out where the airflow was actually going. So we measured where the air was going, not just is there enough airflow, because it had good ventilation. But what was happening was air was going out from an infected patient's room straight into the corridor and straight into the nurse's station, where people were dropping their guard. They were always very careful when they went into a room, but they didn't realize that the virus was literally being taken straight out of the room really fast. And the more you turned up the ventilation system, the faster it went out and into that corridor where it slowed down and hung around the nurses. So once we showed them that, and we actually showed them flow visualization of where the air was going, and what happens when you put an air purifier in, basically takes all those particles away. They were like, yep, get as many as you can in. And with the hospital, it's extremely valuable because the rooms are so small, and the air purifiers are ideal for small spaces. They're really good at cleaning up small spaces. If it's a big area like an office cubicle in a big office building, it's going to be pretty hard to clean up that air because it's so big. But a hospital room, classroom, hotel room, ideal for air purifiers. And my guys are literally doing work now with the hospital, making sure that their air is clean inside a room with air purifiers.
Jason, thank you very much. Any final thoughts before we wrap up the interview?
I think that ventilation is extremely important. I think that there's many other health benefits, and I don't want to conflate issues, but there are many other health benefits for schools as well as the general public from cleaning up the air inside our indoor spaces. So air purifiers can have a lot of benefits. An important thing to say is there aren't that many levers we can pull to improve ventilation. You know, there is a climate crisis, don't forget. We can't just turn up all the heating and ventilation and cooling. That is one of the most expensive. Something like 50% of building costs are heating, ventilation, and cooling. So we don't want to give the wrong advice and cause ourselves other problems. And doing things like opening windows and doors can be really great, but it's not. You know, a lot of office buildings, for example, or even new schools don't have opening windows, so it's not an option all the time. So air purifiers are one of the few options that we have. They don't do any harm. We've shown that they're not going to do any harm. They're not going to blow virus across the room to somebody else. That's not how they work. So it doesn't seem to be much of a downside to me. Long term, what I would like to see is we don't want to be using little portable domestic air purifiers all the time. We want this as a cleaning solution on an industrial scale. So my view for the future, I think, is to have an augmented ventilation system, which is just about cleaning the air and doesn't try to heat and cool it because that's expensive. So I think inbuilt industrial scale air purification systems, like you would have in a clean room where they build semiconductors, for example, the technology already exists. I think we need to get this into our buildings for a safer future.
Jason, thank you very much for this. Really appreciate your insights.
Thanks for having me, Mark. It's a pleasure.